Okay, so we're going to do the suture and staple removal. Again, we're going to do all the same steps from the first video, checking the order, make sure there's an order. We're going to gather our supplies, check the integrity, the expiration, sanitize when we go in the room, identify our patient, name, date of birth, check for allergies, provide privacy. And my supplies for this this procedure is going to be our suture removal, our staple removal, saline to clean. I have some gauze to clean the wound, extra if needed, gloves, steri strips. So that's all our supplies. And so what we're going to do initially is going to sanitize, put gloves on. So go ahead and put gloves on. We're going to sanitize, got our gloves on. And then from there we are going to, if they do have a bandage, may not have a bandage on it, but if it does, same as earlier, we remove the tape parallel to the skin, and then we would inspect, check exudate, characteristics, amount, smells, and then we would get rid of this, so toss that out, and then we would also remove the gloves with it. And then from there, we are going to hand hygiene. And then after we do our hand hygiene, I'm going to inspect the wound or the incision line. So I'm assessing the incision line for RETA, which is redness, edema, ecchymosis, drainage, and approximation. So once we've inspected our incision line, then I'm going to hand hygiene. Before I do that, I'm actually going to just open my, we're going to do suture first, so I'm going to go ahead and open my suture kit. So I'm going to open my suture kit, and that's going to be ready to go. Okay, and then hand hygiene. Apply my gloves. Go ahead and get my gloves on. Okay. And what I need to do is first I need to clean the wound area. So I'm going to have my gauze, just normal saline, pour it, so just have it ready, pour it, and then same thing with the cleaning, we're gonna drain over any excess, and then we're just going to clean from the least soiled to the most. And with this, since we're removing and the wound should be approximated, it's just gonna be over the incision line. But if for any reason there was excess on the sides, we can get a new one and go off to the sides if we need to. But it should just be one clean one down the middle if everything is healing properly. And then just dispose of that, and then we're going to go straight into the removal. So we're going to use our forceps in our non-dominant hand. The scissors are going to be in the dominant hand. And what we're going to do is we're going to grab the knot and we're going to pull it away from the skin. That way we can get our scissors under the knot, cut, and then remove. And I should have put this in here into my tray, but I would do that for each suture. and then apply. I can put this away. I can apply steri strips. So again, I would cut my steri strips approximately 1 inch, and I would apply them every 1 inch, 1 centimeter, and I would apply them every 1 to 2 centimeters across the entirety of the incision line to hold it together, to make sure it stays approximated. And that's it for the sutures. Let's go ahead and move to the staples. So for the staples, let's say I'm starting from where I did with the suture removal. So I had already just cleaned it, put sanitized, clean, put gloves on, and now I'm at the staple removal kit, or the staple removal section. So we have our staple remover, and we've already assessed the wound. Just doing the alternate procedure. We're going to put the forks, the two prong forks at the bottom of the tool, is going to go under the staple. And what we're going to do is so you're going to get it under the staple, and we're going to fully depress. So we fully depress, and what that's going to do is it's going to open up the staples under the skin, so you can go ahead and just pull it straight out. So pull it straight out, that way we won't damage the skin. So you want to make sure you fully depress it and you see it indent. That's how you know it's straight and ready to come out. And then we just go ahead and put that in our tray. And what we're going to do for this is we're going to do every other staple. This one doesn't have too many, but what I would do is I would skip the next one, and then boom, get the next one. So every other, all the way across the incision line. And then what I would do at that point is I'm checking the integrity of the approximation. If for any reason it was coming apart, it wasn't well approximated, then I would contact the physician. But what I'm going to do after I do every other one is I'm going to get my steri strips, again, cut to the proper measurement, and I'm going to apply them. So that way we can hold the wound shut. And then what I can do is go back after I did that and remove the rest of the staples. Again, just making sure we always fully depress. We visually see the indentation, and then pull straight up. And then I would, after I'm done with the removing everything, steri strips are on, I'm going to just clean up my mess, position my patient for comfort, and then I'm going to document. So, and again, take these off, sanitize. So take these off, sanitize after I clean up my mess, sanitize, then position my patient, and then go document. What we're documenting is the procedure, how well they tolerated it, and the wound appearance.